Hi, in this video, I'm going to be talking about some strategies for coping when you're waiting for test results. Whenever I give a lecture on oncology emergencies, I always include pending test results as a medical emergency because we find our bodies emotionally reacting just as if it were a physical emergency. You're waiting to find out, has the cancer spread, or is the cancer responding to treatment, or am I having the symptom because the cancer's come back? How could you not be anxious? And we don't want the test results rushed because then they're not looked at as well. You don't want, in other words, a preliminary report. We can give you results that we look at ourselves, but they're not the final report. And I strongly advise that you wait for the final report because things really do change between the preliminary and that final signed report. Now, one thing I'm going to say as an aside is because of open notes and the CARES Act, you have access to your test results even before sometimes your physician has seen your test results. If you are the kind of person who would prefer to have the doctor explain the results to you, you don't have to look at them. But if you're really anxious and you find that more knowledge is power, it can be very helpful for you to go into your medical record, your patient portal, and take a look at those results yourself. Most of the studies that have been done on open notes have found that patients like having access to their information. This is not the case for everybody, and there's nothing wrong with you if you are not one of those people. We use a lot of jargon in our reports, and oftentimes we say we're doing a test for a reason that we are actually pretty sure it isn't, but you have to write something down in order for the test to be done by radiology or pathology and paid for by your insurance. So be really careful with how you interpret the reason for the test. Okay, so you're waiting for the results or you're waiting for the doctor to call you with their interpretation of the results. How do you live with that stress? And again, it is stressful. The first thing I would say is what can you control versus what you can't control? You can control how you manage the stress. You can control the stories you're telling yourself. So if you are a catastrophizer, like I am, I go to the worst case scenario. Seriously, a lot of us are like this. Try to ask yourself, is this story helping me or is this story hurting me? In most cases, it's hurting us because we put a lot of energy into the worst case scenario. It ends up not being true, and our body reacts as if it is. So we go through the worst case scenario, and it's actually not the case. Going through the worst case scenario also doesn't protect us from the worst case scenario. It doesn't stave off bad things that happen. A lot of us are prone to magical thinking. We think if we worry more than anybody else, that it will keep that thing from happening. I wish that were the case, but it's not. And I understand the impulse. Another key thing that can help is to get really detailed information on when you might hear back. So we might say in a few days, we'll get the test results back. You don't know what that means. Is that 2 days or is it 5 days? So it's not a bad thing to ask, are you saying 2 days or 5 days? Pathology reports can take a lot longer because if it's a bone biopsy, for example, it has to be decalcified. All the calcium has to be dissolved before we can even look under the microscope, and that can take a lot longer than another type of biopsy, for example. The same thing with scans. If the radiologist is not on that weekend, or if you're having a test done on a Friday, it's very likely that the attending radiologist, the one who signs the report, won't look at that till Monday or possibly even Tuesday, not because they don't care about you, but because of the sheer volume of reports that they have to look at and the amount of time they want to spend looking at each report. If the doctor hasn't called you back and you're waiting, it's probably because they want to compare the most recent test with the one before, or they want to get on the phone with the radiologist before they call you and send you into a tailspin. They'd rather have that conversation with the other doctors to make sure they're giving you the most accurate and helpful information. So as you wait, tell yourself that the right things are being done. Ask for information on when you might hear back. If you haven't heard back, send your medical team a message and let them know that you're waiting. Let them know that you're anxious. Now, how do you deal with that? Let's say you know exactly when it's coming back and you know exactly why it's taking as long as it does, and you want it to take a while because you want the most accurate results. How do you deal with that anxiety? What I would ask is for you to think of a time you were waiting on other test results. Maybe you were waiting on an exam grade, or you were waiting on the results of a job interview. Use those, even though the stakes are different, use the same techniques that you use. So let's say you have an interview and you're waiting to hear. What kinds of things do you tell yourself? You tell yourself, I've done everything I can. I gave it my best shot. Maybe it wasn't my best interview, but I did the best that I could. Those types of things, I've done everything I can, the right test is being done, there's nothing I can do while I wait. Those exact ways you talk with yourself when you're waiting on anything else can be very useful. I'm not trying to say that waiting to hear about an exam grade in 6th grade is the same as waiting to hear if your cancer has recurred. Not by any means, but you have it within you to talk with yourself in a way that helps you wait while you live with uncertainty. The other thing that's really helpful is figure out ways you can get rid of that pent-up energy. I have had people paint their bathrooms or their living rooms while they wait, or exercise, or call up a friend, or write things down. To refer you again to our journaling video, writing things down, writing what's stressing you out can be really helpful in terms of sort of detoxing, if you will. You just dump it all out on the page. The other strategy, and the last one I'm going to cover, is set aside a time to worry. Sounds kind of weird when we're talking about how to cope with worry. I find that if we don't set aside time to worry, it's constantly there from the minute we wake up till the minute we go to bed at night. So if you can find a time, whether it's in the morning or between 4 and 6 o'clock, I don't recommend you do it at bedtime, to just sit and worry. And I know it sounds really funny, but it will burn out. That worry will just exhaust itself. It'll be like a fuse that's blown or a battery that gets drained. Instead of avoiding your worries, actually face them head on. This may not work for everybody. None of these tips may work for every single person. That's why we're giving you a range of different strategies to cope with anxiety as you wait for test results. I hope this has been helpful. If it has, click like and subscribe. Share it with a friend. Show it to the people who are supporting you so they can remind you of these strategies. Follow us on Instagram, and as always, you can go to yerbba.com to get your personalized report.